So you're very welcome back, folks. I'm joined here now at the minute by Pat Tracy, and Pat is the trainer of the CFR group here in Castledermot. So what's going to happen now is we're going to go through a scenario, and the first scenario we're going to go through is that Pat is not feeling well. He's going to ring for an ambulance, and we'll talk you through exactly what's going on. So when Pat rings for an ambulance, he's going to give them a little bit of information, and the CFRs are going to be alerted, as when Pat is actually talking to the to ambulance control. So we'll just go through it. It won't take too long, and I'll narrate going through, and Pat and the CFRs coming in. You'll hear what's going on as well, what they're actually talking about. So we're going to hand over to you there, Pat.
Right, I'm just ringing 999. Hello. Could I have an ambulance, please? Yeah. My phone number is 086 074 9068. My address is Ballinagary Upper, Castledermot, County Kildare, and it's R14890.
So Pat is after giving his address. Now he's going to tell them what his symptoms are.
I'm suffering with severe chest pain, going right down into my arm, and I'm feeling very uncomfortable for the last half an hour, 3/4 of an hour.
Okay, as Pat is talking to the ambulance control, the CFRs are after being activated. That's what happens. This is the live CFR phone, and as Pat was still talking, the CFRs are activated. That text message is now gone out to the CFRs, and the next thing we're now going to see is the CFRs arriving at the scene. So Siobhan and Liam are coming in. They're going to introduce themselves first to Pat.
Hi, how are you? I'm Siobhan, this is Liam, both from Castledermot CFR. What seems to be the problem?
Fierce chest pain.
Fierce chest pain?
Fierce chest pain, yeah.
Okay, and what's the name?
It's Pat Tracy.
Pat Tracy. Okay, Pat. And have you taken any medication for it?
No, nothing.
Nothing. Okay, and are you on any medication at the moment?
I'm on a blood pressure tablet and on a cholesterol tablet as well.
Right. Oh.
The sweat is pumping out of me here now.
Okay, and do you have any bleeding ulcers, Pat, or bleeding disorders?
No.
No, okay, and you're not allergic to aspirin?
No.
No. Okay.
Okay, so what you're after seeing, folks, is the responders are after coming in. They're after doing a very quick assessment on Pat. And what they're after finding out is if Pat has any allergies, any bleeding disorders, any bleeding ulcers, and they already know that Pat is over the age of 16 because that information came in on the text. So what the responders are going to do now is administer aspirin.
Okay, I'm just going to give you some aspirin, Pat, and that will help the situation, alleviate some of the pain. Okay, I'm just going to check with you, Liam. You're happy? This is in date, and it's 300 milligrams of aspirin.
Yeah, that's perfect. Yeah. Well
The pain's getting worse.
Okay.
Pat.
Okay. Can you just chew this, Pat?
Yeah.
Okay.
Okay, so Pat is after taking the aspirin there. He's also telling the responders that the pain is getting worse.
I can have a drink of water. I need some water.
No, you'd be better off not having anything at this point in time, okay?
Right.
The ambulance will be here shortly, so just try and relax and take some deep breaths.
Can I go to the toilet? I want to go to the toilet.
No, we'd actually prefer if you said sitting because you seem to be uncomfortable at the moment.
Oh, now Pat folks is after collapsing. He's after going into cardiac arrest, and now the responders have a different situation. So the first thing Liam did there, I don't know whether you saw, Liam took out the phone out of his pocket, and he's after ringing ambulance control, and he's after changing the situation to cardiac arrest. Liam has started chest compressions, and Siobhan is after taking out the defib. Siobhan is putting on the defib, and Liam is still continuing doing compressions. So as Liam continues on, 2 hands on the chest, you can see that the head is lighting up.
Patient's bare chest.
So Liam has continued the compressions. The red lights is actually just showing what the blood flow would be like when you're doing compressions.
Stay clear, everyone.
Do not touch the patient.
Stay clear, everyone. Don't touch the patient.
Okay.
Shock advised. Charging.
Stay clear, everyone.
Stay clear of patient. Deliver shock now. Shock delivered.
Okay, folks. So you saw there that the
Begin CPR.
The defib actually did an analysis, showed that a shock was advised and a shock was delivered. Very important that nobody was touching the patient while this was going on. And Liam is continuing on doing the compressions, and the defib is actually beeping in time with the way that you should be doing the compressions. Liam has his 2 hands interlocked over the patient in the middle of the chest, and pressing down, and it's going up and down in time with the metronome of the defib. So the defib actually tells you folks what to do. So don't ever be afraid of a defib. So you can see Liam there continuing. He's continuing the compressions, and what will happen then is Liam will do a set, and Siobhan then will take over, and Siobhan will do a set, and it will get reanalysing. After about 2 minutes, the defib will reanalyse again and say whether a shock is advised or not. The CFRs will continue doing this until help arrives, until the ambulance arrives. That could be within 2 minutes, it could be within 10 minutes, it could be within a half an hour. But the CFRs were on site when Pat went into cardiac arrest, so Pat is going to have every chance of survival. So Siobhan is now taken over from Liam. So there's good compressions continuing, and that's how the CFRs actually work. They keep swapping over so you don't get overtired. So I think that's enough, folks. Thanks a million. So that's just shown you how you do compressions. And if Liam there just on camera, when we'll just take off Liam, if you just exaggerate there what you're doing. So if you can just show how you put your hands together. Okay, so you can see Liam is interlocking his fingers, and he's using the palm or the base of his hand. He's getting the center line across the patient, and then his arms locked out, and then he's just down in compressions, down until you hear you could break a couple of ribs when you're doing compressions, but if you save a person a few broken ribs, is the least of their worries. So that's what happens with a chest pain going into a cardiac arrest. And like Amanda said, you're giving the patient the best chance if the CFRs are there, or if you go and if you get there, start your compressions as quickly as possible. You're giving that person every chance. So thanks a million, folks. And I'm going to get Pat to come back in. And when Pat is, we're going to do a second scenario. And there's a question there. What if you're allergic to aspirin? If you're allergic to aspirin, you just don't take it. You know, the idea of the aspirin is if you have a blockage, it thins the blood and just helps the blood flow easier. So if you're allergic to aspirin, it won't be administered. So if you tell the CFRs or the paramedics when they arrive that you have an allergy to aspirin, it just won't be administered. Pat, welcome back to us.
Thank you, John.
Great to see that saved you. Pat, that's really, you know, that was what actually happens in real life. You make the call. As you're still on the phone, the responders are dispatched.
Correct,
so
yep.
At times, the person or the family member could be still on the phone to ambulance control when the CFRs arrive in.
That's correct, yeah.
So, Pat, we're going to go to a second scenario. And the second scenario we're going to go through is a stroke. And most of the calls that the CFRs around Castledermot are getting called out to are actually either chest pain or stroke. We do get the cardiac arrest as well, but the high percentage are chest pain and stroke.
Yeah, that's correct, yeah.
So Pat is going to, again, we're going to have a scenario where Pat is not feeling well, but we're going to skip. We showed you how the ring and ambulance control and all that works, so we're not going to go through that again. So we're going to pretend now that Pat is having a stroke. I'm going to pretend that I'm the person who is with Pat. I have rang for the ambulance, and the first responders are dispatched. So the first responders will just arrive in now in a second.
Hi, who are you?
Oh.
This is Siobhan here from Castledermot CFR with Liam Mangan. How are you feeling?
Not great.
Not great today. And what's the name?
Huh.
Pat. Okay, Pat. And are you able to give me a smile? Okay.
Okay, so they've asked Pat to give a smile. So somebody who's having a stroke, one of the features of a stroke is face. So if somebody can't smile, you know, that is a sign that they're having a stroke. And sometimes, you know, they mightn't feel like smiling, so you might say maybe just show us your teeth. Okay?
Okay, now Pat, I'm just going to let Liam take your two hands there and just hold them out and relax for a couple of minutes. If you wish, close your eyes and just nicely and relax, and Liam is going to let go.
Okay, so you see there that Liam held out the arms. So this is the A, arms. So when Liam held out the arms, Siobhan asked Pat to keep his arms up, and you saw that one of his arms fell straight down. Now, we don't want to alarm Pat, you know, and tell him that. So Siobhan told him that's fine, that's okay.
Now, Pat, I'm just going to ask you to say a quick, simple sentence for me. Can you say the sky is blue today?
The sky is blue.
Very good. That is absolutely excellent, Pat. Well done. Now, the ambulance is just on its way. We're going to stay with you. And okay, and if you get to feel any worse, just let us know.
Okay, so Siobhan then asked Pat to say a simple sentence. You know, she asked him to say the sky is blue. Pat wasn't able to say it fully, but Siobhan still told him, you know, well done, Pat. That's something that you don't want to alarm the patient, so you keep the patient as positive as possible. So what Siobhan did there was she went through what's called the FAST assessment. It's face, arms, speech, and then time. Time is of the essence when someone is getting a stroke. So it's time to get them to the hospital. The first responders are after being sent out. So it's not, you know, for somebody at home, the T for time is it's time to call the ambulance. Okay? For the first responders, it's the time it is that they are now there at the call. So the ambulance will come. The first responders' job is actually just about done. There's nothing else that the first responders can do for a stroke patient. Only stay with them, make sure that they're comfortable, make sure that they're not in any danger, that they're sitting down in the right position, that they're not in danger of falling or anything else. So that's it for stroke, folks. Just the FAST assessment. If everybody can know the FAST assessment, and you don't have to be positive on all four. Isn't that right, Siobhan?
That's right, yeah. Just one of those symptoms is enough to indicate that it may be a stroke.
Okay, and another sign of a stroke, which doesn't come up on the FAST assessment sometimes, that somebody can just sound very, very confused.
That's it. Sometimes they're just not making sense. So you could ask them what day it is. It could be Sunday, and they would say it's Monday. You could ask them where they are, and they might say they're outside and they're sitting in the sitting room. So confusion can be an added sign of a stroke. So yeah,
or they could give you a completely off the wall answer, like, you know, you could ask them, you know, what day of the week it is, and they could answer you with blue. You know, so just something like that as well. So listen, thanks a million. Thanks for all the great work that you're doing in the community. This is what happens if you ring folks. You'll see a Liam and a Siobhan in the jackets coming through. You'll see as well, like, they're in the jackets, and also they have an ID. You can see as well, for their own safety, they have the gloves on and they have masks on. We still have COVID in the community. There's still COVID out there, so the responders are wearing their gloves and their mask to protect themselves. So this is how you'll see a responder coming to your door if you ring with one of the triggers that gets the first responders out. So thanks a million again, and I'll just get you to stay there for a minute. What our next part of the show is, I'm going to be joined by three guests. I'm going to be joined by Dimpna Byrne and Elsie Nolan and Eugene Horn, and the three of them have different stories to tell. They have been affected by the first responders. The first responders have been out, and in Dimpna's and Elsie's stories, unfortunately, you know, the outcome wasn't the best. But we're going to hear about, you know, what the first responders actually did in those at those outcomes. So, and then Eugene has another story, and we're going to find out how it's so important to know how to do CPR. So stay with us. We'll be back in just a couple of minutes. We'll just get set up for that, and we'll be right back. Thanks a million.
Can I just say one thing, if we're still on there?
You can.
Yeah. Just for Restart a Heart Week, we have a number of leaflets that we're going to leave here at the centre. Free to read them, take them home. And we also have a magnet that you can actually stick to your fridge. And it just gives the basics of the FAST assessment and compressions and what to do in the case of emergency. Very good if you've got young kids in the home, and you put your code on it so that they know what to do if by chance parents or grandparents collapse.
Thanks a million, Siobhan. So that's here at the centre, and you have a selfie frame as well, have you, Siobhan?
We do. So if you know how to do CPR, you take your picture with the frame and post it up on your social media and let people know that you know how to do CPR. Okay, thanks a million, and we'll be back in a few minutes.
You're listening to What Matters on Radio Castledermot with John Phelan.